are normal anatomical structures that we all have. These anatomical structures made mostly of special vascular tissue that sits on the top of the anal canal. The reason we all have hemorrhoids is because they play an important role in the mechanism of continence. This vascular tissue can inflate and deflate, contributing to the fine closure of the anal canal. Only when these normal anatomical structures become abnormal, like this overlap, increase in size, become congested, they start producing symptoms, and this is when we talk about hemorrhoidal disease, which should not be confused with hemorrhoids as such.
Again, the symptoms of hemorrhoids depend on whether they're internal or external problems. If they're internal hemorrhoid disease, internal hemorrhoids typically will present either with bleeding with bowel movements or prolapse, where part of the hemorrhoidal tissue comes out of the anus and then goes back in, either by itself or with pushing it back inside. They're usually painless at that point. External hemorrhoids, people know. They know because it's painful and there's swelling and they can feel it. And external hemorrhoids are outside the anus and belong outside the anus. But when they become thrombosed, it's usually a self-limited process that lasts for about 5 days. And depending on when the patient comes to see us, we sometimes can remove the clot and help them feel better in the short term.
Become abnormal when they become swollen and inflated over their normal limits. The reason why they become abnormal could be different. Normally, generally speaking, everything that can cause a prolonged increased pressure inside the abdomen, leading to an obstructed outflow of the blood from the hemorrhoids, can in time lead to abnormal hemorrhoids. For example, things like chronic constipation, spending too long sitting on the toilet trying to defecate, can certainly contribute to the formation of hemorrhoids. But also other relatively common things like pregnancy can also lead to the same problem. Patients may be predisposed more than others to this condition, and in those cases also simple standing up for prolonged time or strenuous physical exercise may contribute to the development of abnormal pathological hemorrhoids. People can do few little simple things to minimize the risk of developing hemorrhoidal disease. First of all, it is fundamental that we maintain a very healthy diet, ensure that we have an intake of fiber with our diet, including vegetables and fruit, and we can take, of course, fiber supplements as well. Also, fluid intake is very important, and we all should take at least 1.5 liters, 2 liters of fluid with our diet. This to ensure that we minimize the risk of getting constipated and therefore the need for straining when opening our bowel, which is one of the most common causes for hemorrhoids. It is also very important that when we do go to the toilet to open our bowel, we try to minimize the length of time we spend sitting on the toilet, and we only stay there for as long as needed to open our bowel, avoiding reading or checking our emails while sitting on the toilet. These simple little measures will minimize the risk for each one of us to develop hemorrhoidal disease in the long term.
Different classifications for hemorrhoids, but in simple terms they can present either on the inside of the anal canal, and patients may notice these hemorrhoids because they cause itching or discomfort. When they become larger, they can prolapse out of the anal canal, and they may spontaneously go back in after the patient's been to the toilet. In many cases they won't, and patients will have to push them back in on their own accord. In some patients they will prolapse out and not actually go back in on their own, even with pressure. And in other patients, they will be external the whole time, which has led to some of the different classifications. So patients can have a combination of internal and external hemorrhoids, or they may purely have external hemorrhoids on their own, or they may purely have internal hemorrhoids. The importance really is in the symptoms that the patient has, and also in the treatments that can be offered. Because really, internal hemorrhoids can largely be treated in the clinic and don't usually need surgery unless clinic treatments fail. External or prolapsing hemorrhoids are much more likely, patients are much more likely to need banding and injection in the clinic, but are much more likely to progress to need surgical treatments or may need surgery from the outset.
Or not, I will advise a patient to keep the hemorrhoid and suffer through it, or to go ahead and excise it, most commonly in the office. The most common treatment approach for internal hemorrhoids in this country is hemorrhoid banding. This is an office procedure where I place a tiny little rubber band right over the hemorrhoid, causing the blood supply of the hemorrhoid to be cut off, and then in about 4 or 5 days the hemorrhoid actually sloughs off with the bowel movement, and the patient doesn't even usually notice that this has occurred. I will usually offer this treatment to patients first because it is much less painful than operative treatment options for hemorrhoids. Unfortunately, the banding technique does not work on the external hemorrhoids because they're on the outside and do have those sensitive nerves in them that will cause excruciating pain if banded with a hemorrhoid rubber band.
Hemorrhoids, also known as piles, are swellings of the anal cushions. These are abnormal dilatations of the vessels within the anal canal. These can lead to symptoms such as discomfort, itching, mucus discharge, and quite frequently rectal bleeding. If the hemorrhoids become large, they can prolapse out of the bottom and may need manual reduction. If you have hemorrhoids, initial treatments should be conservative. These include changing your diet to avoid constipation. Make sure you're well hydrated, taking good volumes of water, and take good volumes of soluble fibre. If these treatments don't work, your GP can prescribe topical treatments that might help with irritation and discomfort. However, if there are prolapsing lumps and the conservative treatments don't work, it may be necessary to see a specialist such as a colorectal surgeon who might be able to offer you definitive treatment. There are a range of treatments depending on the severity of your hemorrhoids. There are simple office treatments such as banding of the hemorrhoids. If this does not work, it may be necessary to perform a formal operation under general anaesthetic. These include a hemorrhoidal artery ligation with rectoanal repair, or alternatively, if there is a large prolapsing lump, the gold standard treatment is a formal hemorrhoidectomy.
Hi, I'm Amy Newman, fitness expert for Gold's Gym and creator of the Perfect 10 workout. I'm going to show you some yoga poses for hemorrhoids. I'm going to first show you the fish pose, and that'll help get the blood going down to where the hemorrhoid is. If you have a hemorrhoid, this is a good way to get that blood flowing. Be on your elbows, both elbows. They're close into your body, hands next to your sides. You're on the top of your head. Breathe deep into your body and let the blood flow. From this pose, you would stretch down, bring your knees on up, and we're going to slowly go into a shoulder stand. Now, if you don't want to go to a shoulder stand, you can just be in a pike position. Having your legs up in the air is also great for getting that blood circulation going. Breathe deep into your body. Relax. Then if you want to go into a shoulder stand, walk your hands up your back, feet up towards the ceiling. Stretch your neck out so you have plenty of room to relax your neck and face. Breathe. Don't hold your breath. From the shoulder stand, you can actually go into plow as well, bringing your feet slowly over. If this is too much on your neck, you can stop in a pike, or you can bring it all the way down. If you want, you can release your lower back. If you can do a plow without it being held with your hands, and just relax. Breathe. And then slowly roll back down. Bring your knees into your chest.
Maintaining a good stool cycle is crucial to prevent as well as get relief from this condition. Eating fiber-rich foods is hence recommended. Such foods include wheat bran, oats, brown rice, sorghum, finger millet or ragi, quinoa, bean sprouts, kidney beans and chickpeas. Also include fiber-rich fruits like prunes, dates, apples, pear, papaya, watermelon, guava, figs and oranges in your diet. Some vegetables that are rich in fiber include carrots, beetroots, broccoli, cabbage, lettuce and bell peppers. You can also munch on nuts and seeds like flax seeds, almonds and walnuts. Liquids also play an important role in preventing constipation since they bind with fiber and make it easier for the stool to pass. Hence, make sure to drink lots of water, buttermilk, coconut water, iced tea or fresh lime water. Avoid consuming any fried or refined foods. Refrain from eating animal proteins such as red meat and chicken because these are comparatively difficult to digest. Eat well and take care of your health.